So it's a real pleasure to be with you all in this workshop. Thank you for those who chose to join this and for those who were allocated automatically to this. My name's Dr. Olivia Donnelly and I'm a consultant clinical psychologist at North Bristol NHS Trust. I can't see you all. It's a very strange thing about working on Teams, and I actually can't see the chat from the screen I've got here, which is why I hope my colleague Holly will join us shortly. I was due to have a colleague, Seema, who's our Associate Medical Director, be my co-pilot for this hour. She's been pulled away to something, and so you have just got me, so we'll do our best together. I'm just wondering if there is a way of me being able to see the chat, because I'm quite keen that this is as interactive as possible. Karen, I don't know if you can help me with this.
I think how have you shared your slides?
I just went to share screen and then desktop.
Right, and you definitely can't bring up the chat. The only other way to try it is to upload and see if you can see them that way. Don't know if anybody else on the chat's got somebody
What
else.
I'll do is, Karen, are you with us for the
Yes,
whole session?
I'll keep an eye on it,
Great.
so I
So
can interject. Yeah,
if you can just kind of keep an eye on any themes, that would be so helpful.
we'll be
And
out in tech.
just
That's fine.
great. And just while we're getting going, if you can, just so that everyone knows who's in this group, introduce yourselves in the chat in terms of who you are and where you work. And I also will just share the rest of the Start Well, End Well team. So there's a whole gang of us. Although you've got me today, there's a collection of us that have come together over this last year as we've co-created this approach to supporting well-being and effectiveness in teams. And I just wanted to acknowledge my colleagues, and hopefully Holly will be joining us soon. And so over this hour, what I want to do is to think about some of the themes that we have noticed and seen at North Bristol NHS Trust. In my role in leading our staff wellbeing psychology team, I'm also a clinician leading our cancer psychology service. And actually at the moment, I'm a patient in our hospital. So I feel like I've got a few different views in terms of, and lenses in terms of what's been going on over this year. I want to think together about this idea of teaming. I put it in kind of inverted commas because it's a slightly strange word, but I hope that it's something that by the end of our workshop today will feel clearer in terms of what we're meaning and just why it's so important in the real busy, complex, dynamic, ever-changing NHS world. We're going to spend some time thinking about this approach called Start Well, End Well, which came about from a late night call during the first few weeks in COVID and has really evolved. And something that we thought would be useful in those early months is something that we're now implementing across our trust. And actually, there have been about 50 trusts in the country who've got in touch with us to find out about this approach. So I hope that it's something that will bring some value and be of interest to all of you in this group. And then just thinking before we finish at 11:30 about some calls to action. What does this mean for you and how might this be useful, whatever your context is? We will do a Mentimeter and there's a code there. I'll bring it up again later, but if you happen to have your phone or an iPad to hand to log into Menti, that's great. So what I want to do is, before we dive into some of the theory and some of the kind of practical aspects, is I want to invite you to take a moment to think about your own experience over this last 3, 6, 12 months. And I'm going to bring up some questions, and the invitation is just to notice what comes up for you as you see these. And the last question will invite you to bring into the chat. But for these first few, so take a moment to think over this last year. This might seem like an unusual question because there's been so many challenges, but amongst that, when you've had a good day at work, what makes it a good day? What matters to you in your work, in your role? We often think about what's the matter, but what matters? What's important to you personally in your profession? What's the most meaningful part of your work? When I think about my day, there are aspects that perhaps are more draining, but there are aspects that really energize me. What are those for you? What makes you proud? You know, when you go home, if you live with a family and you want to say something that's made you proud, or something you want to add on Twitter, or that you just notice, what are some of those things? And when you're at your best, what does that look like? What do you see yourself doing or being that's a sign that you're at your best, including when the going is tough? And now I'm going to invite you to take a moment to think about when your team, you could be a team of one, you could be a team of hundreds, but when your team are at their best, what does that look like? What do you notice? And if you could take a moment to just add your thoughts into the chat. And what I'm going to do is, while you start doing that, this is a very strange thing virtually that I can't see your responses, but I wonder if I could just ask Karen or Holly, when your team are at their best, what does that look like for you? What do you notice?
So we're bringing Holly in. I'm not sure if Holly's here just yet, but
Okay,
so I've got the message across. I'm sure she'll arrive in just a sec. But really happy to support you, Olivia.
thank you, Karen.
So I've just moved across to the CCG into the CLIC team from an acute and community trust, obviously in North Cumbria, and I suppose working in OD for me to me it's a no-brainer. You know, that piece about psychological safety is so important. Being able to be yourself, being able to show when you're feeling a bit vulnerable or you're worried about something, you're nervous about something. Just being able to speak up and be honest. You know, that's when I think people become more confident and start to perform. Still need to have a equal balance, a challenge there as well. But yeah, just that in a leadership role, showing a bit of
Mhm.
fallibility.
Okay, gosh, there's lots there. There's something, as you say, about fallibility. Sometimes we're hearing the word vulnerability. There's something about being able to feel safe to speak up, but that doesn't take away from being able to challenge. And actually, I think in order for us to be able to say different things, to challenge one another, we need to feel safe. That's so helpful. Are there
Yeah.
any things coming up in the chat that you might share? Any
Yeah.
themes that others have about when their team are at their best?
Yeah, really similar, you know, open and honest with each other, great communication, collaboration, and innovation. Um, oh, they keep popping up, so I can't read them quick enough. Energized, you know, that positive can-do attitude, being solution focused. So I
Uh-huh.
guess having that appreciative, more of an appreciative sense of stuff. Happy together, sense of humour, so important. It's an absolute must-have for me from an energy point of view.
Yeah.
So the same sort of words coming up, you know, about honesty, supportive, being open,
Mm-hmm.
feeling able to take risks and being your
Mm.
authentic self. Um, just having a quick look. People are enjoying their work and it's fun to be at work. So true. Um,
So we can be doing really challenging, tough work, but actually there's something here about having fun, about being authentic, about taking risks. And actually, I've asked these questions to hundreds, if not thousands of people over this last year in the trust and in externally. And what I'm noticing is that there are some real themes coming up. What I'm hearing often is that a good day at work, a time when we feel proud, when we feel our teams are at their best, isn't necessarily the stress-free times. In fact, for many of us, there will be very few, if none, over this last year, and even probably beforehand. What I'm often hearing is that some of the key factors are this sense of making a difference, of having an impact, but also of making a difference together, this sense of being supported, relying on one another that you shared. That comment of a can-do attitude, you know, together, and being able to do that without hiding, being open and honest and authentic. And so these questions are ones that I'd actually really encourage you to bring up in your teams and your team meetings. And as a psychologist, I think often people, well, maybe less so now, but I think previously there's a sense that our role is about getting rid of stress or helping people to remove that. And yet, if we think about this, it's a colleague of mine at North Bristol Trust. If he is consistently working on an understaffed, overstretched ward without enough support, maybe as a locum, not even feeling part of a team, feeling stressed, feeling overwhelmed at times isn't a mental health issue, it's an organisational syndrome. And so what we're really seeing, and what I am really passionate about, is this sense that resilience and well-being are so much more helpfully seen as processes that arise from strong connections between us. These dotted lines that you can see. And that it's really important that when we're thinking about interpersonal team well-being and effectiveness, that this really isn't just about our individual qualities, our individual resilience or individual experience, skill, and so forth. But that what we know is that being in a team isn't enough. Most of us, if not all of us in this space, are in teams. But the quality of these connections is really key. And that's where this word teaming comes in. This sense of teaming, the ing being a verb, this sense of how are we behaving in our teams? How are we acting, particularly when the going gets tough? And it's this question that I am really interested in, excited in, and that our Start Well End Well team have been working on together. And so what I'm going to do, and normally Seema is the ninja of Mentimeter, not me, so we'll see how we go. But what I'd like to do is if you could go to Menti either through this code or the QR code, and to add your thoughts and ideas from your own experience within your teams and others of what you are noticing seems to be influencing the quality of teaming. And I'm just going to move out of these slides, and hopefully, Karen, let me know if you can't see this Menti slide, but hopefully soon we'll see some words popping up in terms of your thoughts of what influences the quality of teaming, how we behave within each other, with each other in our teams.
Olivia, it's just saying this question is not open for voting. The questions come up on
Oh,
my phone. What influences the quality of teaming? But just on mine it says that. I'm not sure if that's.
okay. So what we're going to do is let's go back, let's revert to the chat, and apologies for the tech side of things. If you could just add this into the chat box just to save us time with reloading it, and I will come back to my slides. So if when words come up, Karen, if you wouldn't mind just saying some of the
Yep.
things that are showing up, that would be so helpful.
Yep.
This is teaming in action. Karen and I have never worked together. We are teaming on the fly, as if we'd planned it this way.
All planned. So what influences the quality of teaming? So far we've got trust, leadership, honesty, openness, compassion, mutual respect, inclusivity, mutual respect again, communication, shared purpose, personalities, personal behaviours. Oh, that's coming up so quick I can't read them. Kindness, shared vision, fun, shared purpose again.
Super. So some of these are words that actually came up earlier when you were saying when your team are at their best. So I've picked up some of these that you shared. This sense of, I really like this word mutual respect. We don't have to necessarily agree with one another, but a sense of kind of really respecting one another's opinions and experiences. This sense of inclusivity. which I think we've been thinking about, well, certainly in our trust more this year than ever. You wondered how come it took a global pandemic to get us to really think about what does inclusivity mean, but it's great that we're thinking about this.
Just a couple more, Olivia, if
Mm-hmm.
you fancy. Understanding each other's roles and knowing something about people, respecting each other's roles, getting to know people as a whole person, not just the person in their job. And then I just missed one a bit higher up, I think was about personalities. Let me just find it. Personalities, personal behaviours leading to breakdown in communications.
Okay. So there's something there about, as you said, the people as a whole person, almost like underneath our lanyards, who are we? And that, I guess, is really linked to some of the other comments around vulnerability. How much do we choose to share with each other? You know, we're often incredibly skilled, aren't we, at zipping ourselves up, and actually sometimes taking that risk to share a little bit about ourselves, maybe the bits that we feel more vulnerable about, more uncomfortable about, a bit about our personal selves, can supercharge trust. I think it's been much harder to do that, you know, when we've been working from home. You know, those, we describe them as the kind of water cooler conversations. I don't know how many of us have water coolers, but those informal conversations we know are so important. So this question of what influences the quality of teaming is something that was explored in an amazing research study by Google, which you might all have heard about. But for those who haven't, Google really were wanting to look under a microscope at what leads to the most high performing teams. So they weren't particularly interested in terms of well-being at the time. They were really looking at effectiveness and performance. And they looked at a whole heap of variables, some which were kind of more individual variables like personality style, experience, gender, leadership, those sorts of variables. And they threw in a whole load of others as well. And what they found, and I think it's really come up in what you've shared, are 5 key factors that we know will predict the most high performing teams. So number 2 is dependability, and this came up in one of the comments in the chat. This sense that actually we can rely on each other to support one another, especially when the going gets tough. This was also shared earlier, the sense of we know what our roles are, we know what the aim is, what's being asked of us, what we're meant to be doing. Now this has been really challenged in COVID. Lots of people have been redeployed. Often people have been starting new roles with no lead time. A sense of meaning in our work, you know, what's important to us in our work, and do we feel like the work that we're doing makes a difference? I think we're lucky, for those of us that are working in healthcare, that part of what got us into our work was wanting to make a difference and have an impact. But we know that particularly, you know, sometimes we get pulled away from doing some of those things that we really care about. But the number one factor that Google found that led to the most high performing teams was psychological safety. Again, many of us will have heard these 2 words, particularly over this last year. And I guess in a nutshell, psychological safety, which someone called Professor Amy Edmondson from Harvard University is often seen as being a kind of leader in the field of psychological safety. Really, this sense of the climate, not an individual factor, but the climate where every single member of our team feels able, safe to speak up without being shamed. So that isn't an individual quality, but it is about those dots between us, the strength of connection. I also want to mention, when we're thinking about psychological safety and about teaming, just some of the work that's being done in behavioural science. So particularly within, well, in my clinical work, but also in my staff wellbeing and organisational work, these 3 pillars we know are really key that come from behavioural science. There's underneath there's a lot of research, but in a nutshell, we know these 3 areas of being able to show up, whether that's in an individual conversation or within our teams, and really be in this moment. Right now, if I'm going to be as helpful, hopefully, and as engaged with you all as possible, I can't be thinking about what I've got going later on in the day. And when I notice my mind wandering, it's really about this skill of strengthening my ability to be as present with you as possible. Like I've said, that's hard because I can't even see your faces. So I'm doing my best to imagine you all in front of me here. But being present in the moment, we know is a core quality. This pillar on the left of opening up, and what that means is being able to dis, sort of disentangle between our thoughts and the facts. So individually, thoughts like, I can't do this, someone else would do this better than me, they're thinking X, and being able to come into the present and really connect with what we know. And the right hand pillar, which is really important as well, which is about knowing what matters to us, but knowing that isn't enough. That sense of can we shift a gear and actually take active steps towards what we care about. And oftentimes when we do that, and I can certainly say that from my experience, even my experience right now, when I'm doing work that I really care about, that's important work, that's stretching me, oftentimes some tricky thoughts and feelings are going to show up, which is why being present and opening up to those is really important. I also want to mention Professor Michael West, who again, many of you will know and have heard of, who's done some absolutely superb work in thinking about our core needs and the sense of autonomy, belonging and contribution being really important. And if you haven't come across or seen his ABC framework, although it's written for nurses and midwives, it's really relevant to all of us, whatever our profession. But that at North Bristol, what I guess we were really aware of all of this theory, all of these models, but it seemed to me and to us, particularly during the early stages of COVID, but actually every day in our work, that there's a massive gap between knowing about this stuff, being able to talk about this stuff, but actually how do you put it into practice in the real, messy, dynamic, complex, ever-changing world that we're in? These kind of contexts, whether that's in theatre, in intensive care, in the pathology labs, in our offices, how do we actually implement this? And so this really began, as I mentioned, during the early stages of COVID, when suddenly, in a very short space of time, like will have been the case in many organisations, we were having to supercharge teaming. People coming together rapidly, needing to coordinate and collaborate in new contexts with new colleagues, many of whom, like me not being able to see you, many of whom are wearing PPE, not knowing who that person was that you were going to need to rely on to do extraordinary, complex, difficult work. And that what we knew is there wasn't time for workshops, there wasn't time for training. There was a sense of how can we embed some of these principles rapidly as part of routine processes that ultimately were going to be led by the teams. So our Start Well End Well team really are working closely with some of our senior medics and nurses, but actually with anyone in a team who is interested in having as healthy and as safe and as compassionate and as an effective culture as possible. So in a nutshell, just to let you know what Start Well End Well is, there are 3 key steps. And I'm going to go through these briefly, but if any of you would like to have a copy of our Start Well End Well pack, and we're developing an implementation guide that is really about how to embed this, you could just email us at startwellendwell at mbt.nhs.uk, but that email address will be on the last page as well.
Olivia, just to jump in,
Yeah,
if anything that you're happy to make available, we'll put on
yeah,
the Click website. So all
great.
of the slides from today will be there. So if you want to add them to there, that would be brilliant.
That's super. And just as I'm going along, Karen, if there are any comments that I need to know about, just let me know. But absolutely, I'll send that over.
Yeah, I will. Just to let you know that I know you can't see everybody, so but I can. So you're spotlighted, so you're in the forefront for us, and so we're really seeing your passion coming across, and everybody does look really interested and engaged. Just so you know.
Great, that's lovely to hear. So the step one of this three-step team procedure is really what we would think of as weaving in some of the best bits of well-being and psychological safety into your routine check-in process. Not every team will have a check-in process. On the wards, most will have a safety briefing. So this is an example of how Start Well End Well has been introduced into one of our wards. So some of these areas will be very familiar to anyone clinical or operational. So things like what are the basics? What are the key tasks today? Who's in? What colleagues are in today? Staffing. Some of the difficulties, are there any concerns? Have there been any deaths? Have there been any incidents? These are core operational procedures that a ward would be covering. But you'll see some additional bits as well. We've got A, which is arriving well. So what we are inviting all of our teams do is to really check in and ask people, can we introduce ourselves, especially if people are in lots of PPE, what your name is, what your role is, and just, is there anything we need to know about you today before we get going? Reminding our team about why our work matters. We're so quick to focus on what are the problems, what are the challenges, which is obviously really important. But there's something different that I notice every time I'm in a meeting where we say, let's just remember, why is it that we're doing this? What's important? If at the end of today we've all done a good job, how will we know? And the bit at the end, F, feel safe to speak up, I think is key as well. What's important here is this is a statement, and this is a statement that we saw in our experience was as important for the more junior colleagues, for the more senior colleagues as well as the junior. I work a lot with surgeons, and some of my surgical colleagues who are absolute specialists. They are top of the game in terms of, for example, sorting out your hand if you have a major hand injury. But some of them were redeployed to working in intensive care, and they actually felt much less confident, much less comfortable. They felt massively out of their comfort zone compared to some of their junior colleagues. Of course, that doesn't fit in with the normal plan of their culture. So this sense of, we want everyone in a team to know that this is a team where it's safe to speak up, and we want you to speak up if you're concerned about something that's happening about yourself or a colleague. If you don't know what to do, whether you're the consultant or the junior, if you feel that we need to do a pit stop, which I'm going to come into a moment, which is a quick way to come together to check out on things, but also to really remind each other that resilience is about our connections between us. This isn't about just you doing your job on your own, that we're a team. The second step in Start Well End Well is what we call a pit stop. And this name came from probably watching too much Formula One with my father when I was a child. But this sense that in healthcare, we don't have a lot of time to pause and reflect, or as much time as we would like, particularly on the wards. But what we know is that sometimes being able to take some moments to pause and check in are crucial if we're going to be effective. So this idea of zooming along, taking a moment, checking in, what's going on, what's challenging, what are we doing well, what do we need to do differently? Is everyone okay? Does anyone need some extra support before we zoom off again? And this pit stop is an approach that we provide some additional training on. There's a facilitator's guide. It links into what some people might think of as a hot debrief. It's not a psychological debrief, which we know is contraindicated, but it's very much skilling up teams and colleagues to feel comfortable to pause, to check in. Because when we were introducing Start Well End Well, I spoke to a number of people, particularly our junior doctors, who said, I'd really like to know how to do a debrief, but I don't feel confident. And so this framework really is hopefully a way to invite and encourage all teams to feel confident. What's really important here is that there needs to be a really clear link between that initial kind of gathering and if there's been an incident which is potentially traumatic or challenging. And at North Bristol, we have a pathway so that teams can have a trauma or TRIM conversation 3 days later with a trained professional, and potentially have access to specialist psychological trauma focused support for those that would benefit from that. What we were also seeing was that at the end of shifts, people were often saying that they were struggling with that transition from being at work, being in this context, to going home. Sometimes people really struggling with sleep, thinking about all of the things that they had on their that they hadn't managed to do that day, or some things that had been challenging. Again, we're not suggesting this is absolutely not something to stick on the wall and just do on your own. And probably what we're learning is it's really unrealistic to actually get a whole team together at the end of the day. But what we're inviting every team to do is to make sure that with at least one other person, you have a chance to have a very brief but meaningful checkout with another human being. And some of these will be operational again. Are there any jobs that are outstanding that you need some help with? But what I want to draw to is aspects around checking in. Are you okay? Is everyone okay? Did you notice anything that would be worth us knowing? And really importantly, it's a theme that I don't know if it's familiar for you, but I'm certainly hearing just how important it is to feel and to share appreciation. So we're inviting everyone just to think before we go, who's one person I can thank before I leave? That might be in person, that might be a text, some way of acknowledging the important work that we're doing. And really that sense of what's one thing that we're going to do to take care of ourselves so that we can transition from work to home, so that we can focus on the other bits of us, the important bits of us that also define us outside of our work. So are there any comments or reflections? I'm really happy if people have any, if you want to come off mute, any questions about those 3 steps before we move into how you might bring this into your context.
I'll just fill a minute while to give people an opportunity to put some things in the comment. I really love the peer-to-peer pit stop thing. I think that's really powerful. Just that bit you said about at the end about who can I thank before I leave. My son is 19 and keeps telling me he's having a gap year. I'm not sure what it's a gap from, but apparently it's a gap year. And he works in a pub just washing up, and he also works in a leisure centre as a lifeguard, and it's so interesting how he talks about how unappreciated he is at the leisure centre, and what he notices in a really busy, hot, smelly kitchen from chefs when they say thank you and appreciate him, and just talks about how much fun it is to work in the pub, which arguably is, well, it's less well paid and it's not a very nice job, but loves it because he's appreciated and he notices it. So and it always fascinates me, that it's so important. It reminds me again. There's a piece there about respecting each other's roles and how important that is. Got thank you, love these visual aids. Do you have a virtual team version? That's a question from Suzanne.
So Suzanne, that's a really good question. So absolutely, that we know that lots of teams are not coming together in person, and so what we we are using this. So, for example, our outpatients booking system, we have a big team which are kind of very separate from the main hospital, who are drawing on aspects of Start Well, End Well. And I'll come on to the kind of quality improvement side and how do we actually implement this, because what we're very much recommending is not that this is a kind of 3 pages of kind of trademarked, you mustn't change tool. What we're really seeing this much more as, this is a kind of, hopefully a bit of a springboard to a conversation with your team, and to really look at how will this work in your area. So, for example, within my cancer psychology team, we now have a just a separate WhatsApp group, a Start Well End Well WhatsApp group. And so who's ever in on a cancer day, we'll just check in with each other at the end of a day just to say, how's everyone doing? And we'll just spontaneously kind of add anything that either might have brought us a bit of joy, or so yesterday I was sitting outside in the garden waiting for one of my patients to meet before we walked to the room, and I just shared a photo and around being in what's a very beautiful hospital. At the end of the day, we got a message on our Start Well End Well page to say, we've had an urgent referral, I'm really struggling to deal with it, would someone mind calling, sorry it's late in the day. So that's an example of, for example, how we're using it a bit more virtually, but I'll say a bit more about that as we go along, but really happy to connect separately as well, if that would be useful.
That's great, thanks. Got a few more comments now. So just one here saying, I can see how these steps could be adapted to use in non-clinical teams as well, particularly the checkout for those who don't currently check out at the end of the working day, I guess, virtually and stuff. Also a message from Louise, who works in NCIC. We've recently introduced a structured debrief process into our care group, which is in between supervision and trim intervention. And so far, 26 staff have been trained with peer training to be offered next. So it's definitely worthwhile intervention. Just give you
That's
one or two.
fantastic.
Yeah. Some other people that have had WhatsApp groups. So easy to make people feel appreciated, but we so often don't do it. I think really like these steps, good to see laid out in a simple way. So those are just a flavour for the comments.
Great. Well, thank you for sharing those. And I want to just share a little bit in a way about what we are and have been learning about embedding this approach, because I think, and certainly if I had my Start Well End Well gang with me, we have been learning a huge amount about this. And although we're working with quite a few different teams in our hospital at the moment, I think our philosophy around it has been shifting. And so I think what's been really clear, and we've got this in our implementation pack, is there's something really important when we go into a team of, I mean, staff are overwhelmed. There's been so much change. We don't want to give them just yet another thing to do. And so we often go in and just first really understand about what's the climate of this team, what's working really well. And sometimes it's actually just about naming what's going really well that links into the approach. People don't necessarily realize that they're doing something, like actually saying thank you, checking in, just how meaningful that is. Like you said, Karen, about your son, the difference in his 2 roles. And then it's really thinking about, are there any areas where Start Well, End Well? I should add up the number of bits on it, but there's probably, 40, 50 elements within there. Is there one bit that might add most value? Maybe just starting with that, like the appreciation area. And then in terms of the tool, I guess what we'd say is we have an editable version, because we're really inviting teams and trusts to create their own version, to tailor it to your area. To experiment and look at what works, and actually to go back and if there are areas that really don't work, abandon them, let them go. We're really not precious about this. In fact, some of what I've loved about working with this group is just this real sense of freedom. Use what's useful, let go of what's not. It's got to add value. And so this is an example, you can't see it there, it's very small writing, but they decided that they wanted in their team Emma Wright, who's in the middle, is an absolutely amazing nurse who they've just got it on one page, and they do have an actual face-to-face huddle within their team, and they've got the 3 steps on one page. They have as well as a huddle board for operational things on their ward, on the neuro ward. They also have a wellbeing board, and Start Well End Well is on there. But really, what was key was having someone champion it like Emma. She also got, at the end of the day, they realised they were never going to come together as a team. So they got their healthcare assistants to have a rota, and each of them now go round and just check in a couple of hours before the end of shift how people are getting on. They realised it couldn't be too late, because if there was something they needed to know, they needed a few hours to make a difference. This is just a tweet from our respiratory team. And again, they were already doing effectively a check-in. So it was the checkout, which was something that was a little bit newer for them. And Seema, who is my colleague, and Jude and co have been doing an amazing job in using Start Well End Well for the vaccination hub within the southwest area, the Bristol and North Somerset and Gloucester region, as part of this process of rapid teaming. And finally, I just wanted to share, I got a lovely message from Paula, who I didn't know, but who'd been to one of my webinars before, and was using Start Well End Well when she was working at the Nightingale. And that we have some funds now to try and roll this out and embed this a little bit more within our trust, but also externally. But just some tips for your areas there. This MIRROR acronym. I think what we're learning that's really important is make it unique to your team. So what are the areas that are going to add value? If we can, involving everyone, including ideally including people who might not necessarily include within team meetings, like our porters, our domestics, who are integral if we're working on a ward. But in an office space, really, can everyone who wants to be part of this be part? Really looking at learning from teams that might already have some good practice. And we often say it's learning the successes, but it's also learning about what didn't work. Let's share our failures as well, because then maybe we can skip some of those steps. And that more and more what we're seeing is that for some teams, they really love having these 3 steps. They feel like there's a framework that they can work from. There's a sense of something to go by. For others, what we're seeing is that actually there's something maybe more valuable in just thinking about the spirit of Start Well End Well, where it came from. So, for example, this sense of, I really liked what Paul mentioned earlier about humanizing the workplace. So the spirit for me of Start Well End Well would be around just caring about one another, checking in, sharing appreciation. The word respect came up quite a bit in the chat box. This sense that you don't need to do something big or unique, but it's those small actions repeated many times that can make such a huge difference. And that what I wanted to also share was that at this stage, when we think about well-being, when we think about teaming, one size really doesn't fit all. I remember in the early stages, there were this sense of phases, kind of coming up towards the peak of COVID, the peak recovery. And I'm sure, like you, a lot of us were going, well, where are we? And I think when I look at this image here, I'm probably in a different place each day. And so I guess we need to adapt depending on what our team are doing and depending on where we are. And also, just of course, this isn't just the work stuff that's affected us. I really feel so strongly that we are all wearing an invisible rucksack with all of our personal lives. And some of us have got a few stones and pebbles in there, and some of us have got rocks. And so if a colleague, for example, seems to be behaving strangely or isn't being that helpful, I think it's always helpful to think, what's in their rucksack? What are they carrying? Are they being weighed down right now? And of course, part of why I'm so passionate about Start Well, End Well and the philosophy underneath it is how can we help have teams where we can share a little bit of what's in our rucksack so we can look out for each other and so that we can do the brilliant work that we're all trained to do. And so at North Bristol, I think a step care approach is not unique. We have a step care approach really focusing on at the bottom the basic physical and safety needs, the workload, up towards access to specialist psychological support. And you'll see that Start Well, End Well, this sense of having routine huddles is right in the middle at the core. But that there are some golden threads that whether your check-ins, your check-outs, your pit stops have different names, look differently, that I'm seeing, that we're seeing are really key. This sense of psychological safety, of being able to and role modeling, speaking up. The value of peer-to-peer support. So often I think that my job isn't to be there delivering care as the lead psychologist, is to empower and encourage colleagues who are really good at doing this, who are experts in their context, to support one another. And that there is real value in those senior leaders, that if we can role model vulnerability, openness, taking care of ourselves, taking care of each other genuinely, I think that really gives permission to others. And so I want to leave just 5 minutes for questions and discussion. It always feels like we could do with more time. But some take-home messages or take back to work messages from where we're at the moment with this approach. That I have it on the bottom of my email. It's become our strapline for our service, which is resilience is between us, not just within us. I really think that's an important message to get out. I think it also adds credibility where resilience has become almost a bit of a tricky word, a sense that of blaming the individual for not coping. So different when we see that when a team is struggling, that's not an individual's failing, that's a team issue and probably an organizational one. So thinking about team well-being is important. Within psychology, our strategy has been absolutely to really put, I'd say 2/3 of our time to focusing and fostering team culture, not on one-to-one support. To develop initiatives around golden threads. So yes, this I'm sharing today about Start Well, End Well, but we are across our organisation involved in lots of different projects, but with some shared core themes. And so it's really about bringing the spirit of these into everything that we do, rather than necessarily focusing on having to use a tool perfectly. Oh, I'll put them all up because they're coming in the wrong order. Number 3 is about weaving well-being skills and psychological safety into routine processes. So I often say that a little bit like we might hide our vegetables into our children's pasta sauce, how can we weave some of the best bits of well-being, of psychological safety, of behavioural science, just into the core things that we do? Can we make sure that every team meeting on the agenda includes what have been the wins of this week? What are we proud of? Not just the challenges. Number 4 is around encouraging conversations about what matters. I notice for myself when we do that, I just reconnect with my energy. And remembering that sometimes it is really small actions. Keeping your phone in your pocket when you walk down the corridor so that you can greet and smile people instead of catching up on that email. that sense of taking 30 seconds longer when you're in the loo so that you can just check in with yourself before you go into work. They're small things, but they can have and make a big difference. Really taking that moment, even if it means that you're 2 minutes late, ask a colleague, are you okay? Number 5 is about partnering with like-minded services. I've noticed that our organisational development teams, our transformation, our HR, we've all got a similar passion about this. So finding out, even if they're not your normal tribe, actually coming together, and we're finding that it's really making a difference working across our various services. Number 6 is this sense of feeling okay to experiment and vigorously discover, that we learn from our, in inverted commas, our failures and successes. That sometimes when things don't go well, it's a sign that we are stepping out of our comfort zone. We're doing innovative work. We mustn't be embarrassed about them. Actually, we should champion them. Number 7 is about compassionate leadership. Although something like Start Will End Well, we invite everyone to be part of it. We're noticing at North Bristol that really investing in supporting our supporters, in looking out for and looking after our senior leaders. They're often holding so much responsibility, but who's looking after them? And when we look after our senior leaders, when they feel able to role model these things, actually some of this happens organically. And finally, for all of you in this group, I guess just that sense, and it's a message I have to give myself very regularly, is giving ourselves that permission and that commitment to look after ourselves alongside what we're doing to look after others, that we are human beings and we're not robots. And just to finish, just this quote that I really love, which is, when a flower doesn't bloom, you fix the environment in which it grows and not the flower. And so we have just a few minutes before we finish. And what I might do is, instead of using the chat box, I might come out of screen sharing, because I'd love to see your faces. And if anyone has any reflections or questions or comments, please just unmute, and it'd be great to hear from you. Thank you so much.
I was going to suggest that to Olivia, to so you get the reward of being able to see, I'm sure how much everybody got out of that.
It's lovely to see you all. Lovely to see you. So we've got Richard.
Hi, Olivia. My name is Richard Massey. I'm a GP in North Cumbria, and that has really helped me to focus my thoughts on what we do. We were small surgery. We have a huddle every day, and we introduced the huddle a couple of years before the COVID pandemic, and what you've just been talking about has helped me realise that we've really lost sight of what our huddle is all about during the pandemic. It's become a very quick, action-focused exercise that people are just turning up to tick a box, and we kind of whiz round, and if people haven't got anything to say, we just move on. And I really think, this has helped me to think about how we could come back together as a team and think again about what the huddle is all about, and how to refocus it and make it a much more positive experience for everyone again, because that's how it used to be, and I think we've just lost sight of it during the pandemic.
Yeah.
So thanks.
Oh, thanks for sharing that, Richard. And I think your experience will be reflected in all of ours, that, it's so natural that we get focused. We can lose sight of these things so easily, can't we? They're often seen as always frustrates me, the soft stuff, but actually it's the hard stuff. And how can we make sure that we prioritize it? And probably, like any behavior, just think about, just personal things like exercise, diet, we do fall off the wagon, and our job is just, especially in a gang, is how do we keep coming back on track? And just so good luck with that, and it'd be really great to hear how you get on. Stay in touch. And just we've got Nicholas.
Hi, hi Olivia. That was great. It's good to see that doing the right thing works, as it were, and it's great it's great that you've done it. so we can learn from what you've done, and you know, and also have that evidence base that doing the right thing does work. It is effective, and we can put it into practice.
Yeah. Great. Well, thank you. Well, I have to say, although we're doing it, of course, nothing we do is that original, is it? A lot of stuff we've been doing is just borrowing it from things we've observed and seen. It was just trying to pull it together in a way. And do you know what? I often think, yes, there's lots of data, but I guess I'd say to all of you, our experience is the best guide we have. So if you leave a meeting or a day and think, whatever it was, even if it was something completely, you know, off center, if that works, keep doing it. And I love something from behavioural science, the term workability, which is a sloppy term, but the idea of, does doing X move me towards or away from what seems to help? That's often a really useful question.
Just time for one more, Olivia. I think Ruth's got her hand up, and then
Hi,
we'll
Ruth.
make sure everybody gets a 5-minute break.
Hi, thanks so much, Olivia. It was fantastic talk. I want to say I loved the last slide actually about we don't fix the flower, we fix the environment around it, and it also made me think we are all the environment. And I think sometimes we forget that actually the way we all behave affects everybody. And I really like the idea of put your phone away and say hello to people, because I think it is so easy to get into a little bubble of your own. So, but thank you.
Oh, real pleasure. And I love that. It's a great note to end on, this sense that all of us are change agents. You don't need to have head of, you don't need to have well-being or whatever on your job title. I think there's something really energizing when we all can make a difference, genuinely. So thanks, Ruth. And really lovely to be with you all. If you want to stay in touch, we have a Start Well End Well email address, or I variably use Twitter, but I hope you have a really good rest of your day and all the best with what you're all doing.